So first, I would like to ask your permission for to use this video for educational purpose and on internet.
Yes.
Thank you. Tell me a little about your problem before we met.
It started in 2012 when I hurt my back, and then
How did you hurt your back?
I worked at a nursing home and I lifted a patient wrong.
Okay, lifting accident.
Yep.
Okay.
And then in 2016, the pain got to the point where I needed to go to a doctor.
Mm-hmm.
I went to Fargo. I had 2 discectomies, one in September of 2017, one in December of 2017. Both failed.
Yeah, but
Then
let's talk about your symptoms before those surgeries. You had back pain, you had leg pain.
Yep, I had back pain, leg pain. My toes
bad was it?
would go numb. It was to the point where I would call into work because I couldn't move.
Yeah. So in a higher level, 7,
Like
8,
10.
9, 10. Okay.
Consistent 10, especially after.
So they did first microdiscectomy. Did it help you, the first microdiscectomy?
It helped for about 2 weeks, and then I felt it instantly. Like, you know when you have back pain when it goes.
Yes.
And it just was instantly.
Was after the 2 weeks after pain the same pain or different pain?
It almost seemed enhanced compared to
Yes,
the first
okay.
pain because it was like it was already irritated from the surgery and.
Same location but worse.
Yes. Another surgery in December, and then my disc ruptured. They think it ruptured the day before surgery, but that surgeon decided that I needed the best option to not get a fusion and to just go on
and do another discectomy.
Which failed. Probably.
Did the second surgery help you at all?
I mean, I had relief for about a month after versus the 2 weeks, so it did
2
go.
2 weeks, a month, yeah. And then the pain came back again.
And then the pain came back again, and I got a referral to here.
At what level was the pain?
It was a consistent, anywhere from 8 to 10.
Oh, okay. And now, do you remember those surgeries? How long did they take, and how long
The
did
first
you stay in the
one
hospital?
went closer. The first one I was in and out same night, and that only took 2 hours. But I was in the hospital obviously longer with anesthesia and such.
Yeah.
The second one the surgery itself took over 4 hours, and I was in the hospital overnight, which was fine.
Yeah.
And then the recovery period for those was way longer, and I couldn't do as much as I could.
Yeah, and you were scared of fusion surgery.
Yes, very scared.
Yeah.
I was told huge scars and no mobility and.
Yeah. Now, the second surgery took longer because they had to go through the scars of the first surgery.
Right.
And so the reherniation and the returning and doing the decompression, that is a big deal. So I'm not surprised that it took longer.
Yep.
2 hours and 4 hours, these are just non-fusion, definitive surgeries.
Right.
A fusion open old-fashioned way is as well. Is regularly can take 4 hours, sometimes even longer, and recovery can be longer. But we didn't do open surgery for you. Do you remember our surgery? When did we do it?
July 6th of 2018.
So we are about 10 months.
Yep.
We are about 10 months. And you were at first scared about that we were going to do a surgery.
I was very scared because I heard fusion, and I was told long, huge scar, and losing over 50% of your mobility. Can't do this. You're only 25. You're not gonna do, you're gonna ruin your life basically.
Yeah.
And then once I talked to you about the OLLIF surgery, and we went over what actually happens and how the scars aren't 6 to 8 inches long.
Yeah. I'm going to actually turn around and show your surgery. This is the surgery we did for you. We did a L5 S1 fusion, and as you see, your bone is beautifully growing, and that just after 10 months, in both inside and outside of the cage, and the alignment is good. And I'm going to swing here. Our surgery took only 40 minutes, and we lost about 50 cc of blood, which is practically nothing. And how long did you stay in the hospital after our surgery?
Just one night.
Just one night?
Yep, and I got to go home the next day.
Okay. How was the pain?
It wasn't that bad. It was definitely worse with the discectomies. The worst pain was the surgical pain and getting used to,
No, how long did it for the leg pain to go away? How long did it take for the back pain to go away?
The leg pain seemed to subside fairly quickly. The back pain was maybe a month, 2 months. But once it subsided everything completely, I haven't had it back.
Okay. So, and how how are you back on your basic daily activity?
Yeah, for the most part.
For the most part.
I just don't lift anything crazy because I don't want to come back.
That's right, that's right. Now, overall, you know, this spine open surgeries are scary, but
Yes.
because you do way more damage to just get in. But I guess by us trying to go over a tube,
Yep.
we could mitigate the damages, and that's why people just recover faster. Overall, you know, comparing the open surgery, even though open surgery you got is a smaller, it's not a fusion,
Yep.
smaller surgery, and the OLLIF, what was the major difference, what you would say?
What I could do after the surgery,
Yeah.
because with the first two, the scar was about this big.
Mhm.
With the OLLIF procedure, I only had 3 minor scars, and it
Mhm.
didn't go back through the original one, so the pain was way less.
Mhm.
And I didn't need help with, I mean, I needed help with some daily activities, but not as much as the first 2 surgeries.
Well, thank you so much.
I wish I would have done this first and not waited.
Well, thank you so much. I really appreciate the interview.